My friend, I want to ask you a very simple question, one that might change how you see your body after turning 50. What if there's one point on your body, an area most men never think about, yet it has the ability to send a warm, strong, deep rush of blood down to the most important places? What if just a few drops of castor oil, combined with a gentle, correct massage each night, could help your body regain sensitivity, bring back your morning reflex, and even make you feel stronger, just like you did 15, even 20 years ago? What I'm about to share isn't a trending hack online. It's not a difficult exercise. It's not a drug or anything that puts pressure on your heart. This is a very old technique, but it's rooted directly in male physiology, and it works best for men in their 50 seconds, 60 seconds, 70 seconds, and beyond. And most importantly, it acts directly on the center that controls erection, sensitivity, and deep circulation in men. So if you've ever worried about not being the same, or felt your body reacting slower or weaker, then the next part is for you. Stay with me, because a few minutes from now, you'll understand why so many men over 50 have tried this technique, and why they've noticed real results. Before we go deeper into this technique, allow me to introduce myself quickly. I'm Dr. Emily Carter, a board-certified urologist with over 14 years of experience working with thousands of men in their 50 seconds, 60 seconds, 70 seconds, and even those well into their 80 seconds. And I've seen one thing repeat over and over again. Men stay silent about the changes happening in their bodies. They think it's fate. They feel embarrassed to talk about it, or they simply don't know where to start. But I want you to know this. The male body has an incredible capacity to recover, even if you think you're past your prime. And the technique I'm about to teach you isn't some random tip without a foundation. It's based on anatomy, neurology, and the way male blood vessels actually function. No medication, no devices, no cardiovascular strain, no invasive methods. Just a simple way to help your body do what it once did so naturally. So whether you're 50, 60, or 75, give yourself a few minutes to understand this method. I believe you'll be surprised by what your body is still capable of. My friend, if you're in your 50 seconds, 60 seconds, or 70 seconds, you've probably started feeling changes that no one ever prepared you for. Those mornings that no longer have the natural response they used to. Moments of intimacy where your body reacts slower, weaker. The sensitivity in that important area isn't as clear as before. And sometimes, even when you genuinely want to, your body just doesn't respond. The sad part is that many men blame it on aging. They believe it's something they must accept, but that's not true. Over the years, I've heard the same lines over and over again. I guess I'm old now. Maybe my time is over. Maybe this is the end of it. But I want you to understand, those signs are not the end. They're simply your body trying to send you a message, a silent shift happening within your blood vessels, a slowing in your nervous system, a tightness in your pelvic floor that you don't even know you're carrying every day. And most importantly, you're not alone. Millions of men crossing age 50 experience these same issues, but very few ever talk about it. Before I continue, I have a small request to better understand our community. Please comment below and tell me, how old are you? And which country are you watching from? I read everything. And that information helps me create videos that truly fit each age group and each real problem men are facing. Now that we understand this is not your fault, let's move into the next part to discover what's actually happening inside a man's body after age 50. My friend, to understand why this technique works so well, you first need to know what's actually happening inside a man's body after age 50. And I promise, once you understand this mechanism, everything will suddenly make perfect sense. First, the blood vessels, the most important factor in achieving an erection. When you're young, your blood vessels are flexible, expanding easily to push a strong surge of blood into the erectile tissue. But as you enter midlife, the vessel walls begin to lose elasticity. They don't open as wide, don't dilate as fast, and don't maintain strong pressure the way they used to. This alone makes you feel noticeably weaker. Second, testosterone. This is the fuel of masculinity, controlling energy, desire, mood, muscle strength, and the quality of erectile tissue. But from age 40 onward, testosterone declines each year. After 50, the decline happens even faster. You don't lose testosterone suddenly. It fades slowly, until one day you realize everything feels very different. Next is the sexual nervous system. The nerves that once responded immediately and sharply now begin to slow down. Signals from your mind to your sensitive areas aren't as crisp. Touch doesn't feel as sharp, requiring more stimulation to trigger the same reaction. And there's another part men rarely think about: the pelvic floor muscles. This deep muscle group acts like a natural clamp, helping trap blood inside the penis to maintain firmness. When you're young, these muscles are strong, responsive, and balanced. But with time, they become weaker, tighter, or lose coordination. The result is that blood escapes more quickly, making erections fade sooner than you'd like. Finally, stress and tension. They don't just weigh on your mind, they trigger hormones that tighten blood vessels exactly when you need them to open. That's why sometimes, even when you genuinely want to, your body simply doesn't respond. All of these factors combine into the feeling of, I'm not the same anymore. But the most important thing I want you to remember is this: these changes can improve, and your body still has an incredible ability to recover if you apply the right stimulation in the right place. And now, we move to the part very few men know about, but it is the key to this entire technique. If you want, I will continue with part 5.1, why castor oil works so well. Before we talk about the secret location that most men never pay attention to, we need to understand why castor oil, a simple-looking oil, has such a powerful effect on circulation and sexual function in men over 50. Castor oil is completely different from regular oils. It contains a unique compound called ricinoleic acid, and this ingredient is what makes all the difference. Ricinoleic acid reduces inflammation, softens tissues, relaxes deep muscles, and helps blood vessels open more easily. These factors are extremely important, especially when a man's circulation has already begun slowing with age. The most impressive part is that castor oil penetrates deeply. It doesn't just sit on the surface of the skin. When warmed slightly and massaged correctly, the oil travels into the deeper layers of tissue, reaching the very areas where blood vessels, nerves, and pelvic muscles operate. When these tissues soften and relax, two things happen. Blood vessels open more easily, allowing strong, oxygen-rich blood to flow into the erectile tissue. Sensory nerves become more responsive, helping your body react quickly and sharply, just like during your strongest years. Many men don't realize that the pelvic region accumulates a lot of hidden tension over time, from long hours of sitting, stress, or poor circulation. Castor oil helps release this tightness, like loosening a knot you never knew you were carrying. Another commonly reported effect is a mild warm sensation after massaging. This is a sign that blood is moving better, tissues are waking up, and the nervous system is starting to receive clearer signals. All of this becomes especially powerful when castor oil is used on the exact area that controls erection and sensitivity. We will get to that location next. If you'd like, I will continue with part 5.2, the hidden point that controls male strength. There is an area of the male body that almost no one pays attention to, yet it functions like the control center for firmness, sensitivity, and the ability to trap blood during intimacy. This area lies between the scrotum and the anus, a small, soft region called the perineum. On the surface, it looks like just a patch of soft skin, but right beneath it are three extremely important structures most men know nothing about. First is the bulbospongiosus muscle. This muscle traps blood inside the erectile chambers, functioning like a natural clamp. When it is strong and flexible, your ability to stay firm is better, steadier, and longer. But with age, this muscle becomes weaker, tighter, or loses elasticity, causing blood to escape more quickly. Right next to it is the pudendal nerve. This nerve carries pleasure and stimulation signals from the genitals to the brain. When it slows down, sensation becomes duller, requiring more stimulation. and responses aren't as fast as they used to be. And finally, the pudendal artery, the main blood supply to the erectile tissue. If this artery doesn't open wide enough, the blood flow won't be strong enough to create solid pressure for a firm erection. The powerful thing is that muscles, nerves, and blood vessels are all concentrated right beneath the perineum. It's like a cluster of switches controlling the entire male sexual system. When castor oil penetrates into this area, it acts exactly where it's needed most, softening tight muscles, helping blood vessels expand, and reactivating sensory nerves. That's why a small area can create such noticeable changes in firmness, sensitivity, and the ability to stay hard longer. Now that you understand why this region is so important, we'll move on to the practical part. How to apply castor oil correctly to get the maximum effect. Now we come to the most important part. How to perform this technique correctly so that castor oil can truly deliver its full effect. First, cleanse the perineal area and dry it completely. A clean surface allows the oil to penetrate more deeply without being blocked by sweat or leftover soap. Next, take about 1 teaspoon of cold-pressed, pure castor oil. This is the type that retains the natural compounds your body can absorb. Avoid any version with fragrance, preservatives, or blends, because the perineum is a sensitive area. Before applying, gently warm the oil. Simply rub it between your hands for a few seconds or place the spoon of oil in a small bowl of warm water. Warm oil softens the tissues, increases circulation, and allows deeper absorption. When you're ready, choose a comfortable position, leaning back, lying on your side, or gently lifting one leg. The important thing is that your body is fully relaxed, so the pelvic region doesn't tighten unconsciously. Begin massaging with slow, circular, steady motions directly on the perineum. You don't need to press hard, just enough pressure to feel the muscles underneath without causing discomfort. Move your hand slowly, covering the entire area between the scrotum and the anus. If you find a spot that feels slightly tight or more sensitive than others, that's usually where tension has accumulated. Massage that area more slowly and gently. Continue for 2 to 3 minutes, or longer if you have time. This is not a technique to rush. The slower the movements, the more the tissues open and respond. After the massage, you can place a warm towel over the area for 10-15 minutes. The warmth, combined with castor oil, helps the oil penetrate more deeply, increases blood flow, and allows the pelvic floor to relax completely. Usually after a few minutes, you'll feel a gentle warmth spreading or a sensation of opening inside. This is a good sign that the blood vessels are responding and the tissues are activating again. If this section is helping you understand your body better, one small action can help spread this information to more men. If you find this helpful, please hit like. It helps YouTube prioritize men's health topics for viewers over 50 who truly need it. Changes after 3 days, 4 weeks. When this technique is done consistently each night, the body often responds in subtle yet meaningful ways. Change doesn't come suddenly, it appears gradually, as if the body is waking up after a long period of slowing down. In the first few days, most men describe 3 very similar sensations: a gentle warmth spreading through the pelvic area, a soft biological tingling, or the feeling that something is opening inside. These are signs that blood vessels are responding, deep tissues are softening, and nerves are receiving clearer signals. By the second week, the changes become more noticeable. The genital area feels more alive. Sensitivity increases slightly, more clearly, and the mind-body connection becomes stronger. Some men describe a sense of fullness below, as if the deep tissues are being nourished by stronger blood flow. From week 2 to week 4, many men are genuinely surprised. Morning erections return firmer and more stable. The ability to maintain firmness during intimacy lasts longer. Responses to stimulation become faster and clearer, and the feeling of physical, emotional connection becomes stronger. At the same time, unexpected benefits appear. The pelvic floor stays more relaxed throughout the day. The lower back feels less tense. Nighttime urination decreases significantly because the pelvic nerves and muscles are functioning more smoothly. These results do not come from a strong intervention or a fast-acting drug. This is the body's natural mechanism being restored properly. Blood vessels soften and open better, nerves become more responsive, the pelvic floor becomes balanced, and deep circulation is restored. When improvement comes naturally, you feel it clearly, not forced, not sudden, but like the body is returning something that was always yours. Habits that maximize the results. For the most lasting results, the body needs internal support. The habits below can double the effectiveness. 1. Stay hydrated. When dehydrated, blood becomes thicker and moves more slowly, directly affecting the ability to pump blood to the genital area. Drink small amounts throughout the day to help the vessels respond better. 2. Eat foods that boost nitric oxide. Spinach, arugula, beets, and dark leafy greens are natural NO sources that help blood vessels open powerfully and stay flexible. 3. Add healthy fats. Salmon, walnuts, and olive oil support testosterone production and keep vessel walls strong. 4. Balance the pelvic floor. Practice gentle squeeze hold, slow release. Instead of strong, repetitive contractions, a pelvic floor that is both strong and soft holds blood more effectively. 5. Reduce stress. Stress constricts blood vessels and blocks circulation. Just a few minutes of walking, slow breathing, or turning off screens early can shift the body into a relaxed state. When these habits combine with castor oil massage, the body recovers faster, the results become clearer, and the improvements last longer. Although this technique is very natural and suitable for most men over 50, there are still a few important notes to ensure your body stays safe and comfortable while practicing it. The first is choosing the right castor oil. Use cold-pressed, pure castor oil with no added fragrances or preservatives. The perineum is a sensitive area, and any extra ingredients can cause unwanted irritation. A single drop of good oil is far more effective than a cheap bottle of unknown origin. Next, avoid applying castor oil to damaged skin. If there are scratches, redness, inflammation, hemorrhoids, or any spot that hurts when touched, let the area fully heal first. Castor oil penetrates deeply into tissues, which is excellent when the tissue is healthy, but may cause discomfort on sensitive or irritated skin. Also, do not use too much oil. The body can only absorb a certain amount at one time, so using more does not make the process faster. 1 teaspoon is enough to reach deep tissues and be effective. While massaging, if you feel sharp pain, burning, or unusual numbness, stop immediately. The correct sensations should be warmth, comfort, softness, and relaxation. Your body is very good at sending clear signals, you just need to listen. 1 important note. If you experience persistent pelvic pain, sudden erectile problems, difficulty urinating, or burning during urination, these could be signs of deeper issues involving blood vessels, nerves, or the prostate. In such cases, seeing a doctor will help identify the exact cause. And if you are taking blood pressure medications, heart medications, or circulation medications, having a quick conversation with your doctor before adding a new habit is always the safest choice. Castor oil does not interact with medications, but improving blood flow can influence your overall circulatory state. This technique is very gentle, and most men tolerate it well. With a bit of attention and patience, you are giving your body a natural, effective, and safe tool for recovery. Right after this, we'll move into a very necessary section, the mental motivation, that helps you understand why the changes after age 50 are not an ending, but simply a reminder that your body needs the right kind of care. When speaking with men over 50, I've realized something. The changes in the body are not just physical, they touch self-esteem, confidence, and the sense of masculine identity. And because of that, many begin to think that this slowing down is the end. But that is a huge misunderstanding. The male body does not shut down after 50. It's simply waiting to be supported the right way, like a powerful machine that needs fine-tuning to run smoothly again. The truth is, the changes you're seeing today are not decline, but signals that your blood vessels need more flexibility, your nerves need reawakening, and your pelvic floor needs balance. When you stimulate the right place in the right way, the body responds far more strongly than you expect. I've seen this in so many patients. Men who believed they were past their prime, yet just weeks later told me they felt younger, more alive, and more connected. Recovery after age 50 is not far-fetched. It's not magic, nor is it an empty promise. It is biology, and biology is always honest. Your body still has the ability to improve. It still has the ability to regain natural firmness. It still has the ability to feel clear, sensitive, and confident like before. Nothing is too late. You just haven't been shown the right approach. A few minutes each night. A small habit, but one that awakens a very important part of your body's natural mechanism. And the feeling when your body begins responding again, that brings more hope than any words ever could. Now, we will move into the next part. The long-term benefits when this technique is combined with foundational habits. When you maintain this technique consistently and combine it with the supporting habits, the body begins to change in a very steady way. Not a temporary improvement that fades, but a deep restoration where blood vessels, nerves, and the pelvic floor work together again. The first benefit many men notice is stronger deep circulation. The blood vessels become more flexible and easier to open, allowing a powerful flow of blood to nourish the vital tissues that naturally weaken with age. This leads to a natural improvement in firmness and the ability to stay hard when needed. Next comes the return of sensitivity. Signals that had slowed or faded are reawakened. Sensation becomes clearer, more vivid, and more connected to your body. Many men appreciate this deeply because it brings back a sense of feeling younger in the truest biological sense. Another important change is the balance of the pelvic floor. When this muscle group is no longer silently tense or weak, you'll feel better blood retention, more stable erections, and more natural, effortless control during intimate moments. Alongside that, many men also notice overall improvements. Deeper sleep, because nighttime urination decreases, a lighter lower back, and pelvic pressure gradually fading. These small changes combine into a sense of relief you may have forgotten existed. But perhaps the most important benefit, confidence returns. Not the kind created by instant pills, but the kind that comes from understanding your body, guiding it naturally, and knowing that your masculine strength is still there, simply being awakened again. And now, I want to hear from you. What worries you the most right now? Firmness? Sensitivity? Or circulation? Leave a comment below. I read all of them, and I use those insights to create future videos that best match the needs of our community of men over 50. Don't hesitate to speak up. Your voice may help other men feel less alone on this journey. Thank you for staying until the end of the video. The fact that you're taking time to care for your health shows that you're not giving up, not accepting decline as inevitable. You're choosing to rise and reclaim what belongs to you. The content in this video is for educational and general informational purposes. It does not replace medical evaluation or personalized treatment. If you have underlying conditions or unusual symptoms, please consult your doctor for proper guidance. Once again, thank you for being here. I'll see you in the next video where we continue the journey of reclaiming strength, confidence, and vitality for men over 50.